Hello, everyone. Welcome to Whole Food Plant-Based. Sorry. Welcome to Whole Food Plant-Based Nutrition. Today, we have the privilege of having a wonderful clinician and my dear friend, Dr. Pritesh Mutha, with us. So, hello, Dr. Mutha. Thanks for giving your valuable time to be here with us today. The floor is all yours. Thank you.
Thank you, Komal, and thank you, Dr. Rastogi. It's my privilege, and I'm very grateful for what you guys do. I'm pretty young, but I'm going to be sharing whatever I have learned and whatever my little bit of experience is. I'm a gastroenterologist, so I'm born and raised in India, and I did my med school in India in Grant Medical College, followed by which I came to US. I did my master's in public health in Houston, followed by residency in internal medicine in Pittsburgh. And then I came on to do fellowship in gastroenterology and hepatology, and stayed on as faculty here at Virginia of Commonwealth University and Veterans Affairs Hospital. And I've been here for the last 7 years as a faculty member. I'm also, by passion, certified in lifestyle medicine. And I absolutely love it. The satisfaction that I get from treating patients, getting them off of medicine is absolutely very something that I look forward to all the time. So I love it when patients actually go home feeling healthier and medicine free. So I'm going to share what I've learned a little bit. Feel free to ask questions at the end. Please note down your questions, and I'll be happy to answer whatever I can at the end. So without further ado, I'll go ahead and start the presentation. The title of the talk, as you can see, is Does Gut Bacteria Impact My Health? So quick disclaimer, this is not a medical advice. The purpose of this talk is to spread awareness about healthy lifestyle. Please consult your physician for managing your medications, because every patient has some little nuances that needs to be managed in a customized way. So before you make any changes to your medications, please have a discussion with your physician and don't use this as a platform to make any changes. All right, so what are we going to talk about today? We'll talk about what is gut microbiome. Some people may have heard this word for the first time. You will hear this word over and over throughout the presentation. So I'll go over the meaning of what it is. Then what does it do? What is its impact on my health in terms of disease and being healthy? So we'll go over those things. You've heard about heart transplant, liver transplant. Here we're talking about stool transplant, and what does it mean and how is it relevant to it? So we'll learn a little bit about that. And I've got some additional ways to stay healthier outside of food. So we'll talk about that as well. At the end, we'll do question answers, and the focus will be especially on GI disorders, right from your food pipe to stomach to intestines. So that's basically what our agenda would be for the day. No bias here. I'm a gastroenterologist. Gut is the most important organ in your body. Now, there is of course a little bit of bias, but think about it. Your body, you grow from tiny little 1.5 feet to 2 feet old, 2 feet in size, a baby, to 5, 6, 7 feet. And how does that happen? You grow from 10 pounds to 150, 200 pounds. How does that happen? From the food you eat, and that gets transformed into your body. So whatever you put in, that's what you become. You are truly what you eat, right? So let's remember that, and we'll learn how it truly actually transforms into your health and disease as we move forward. So the most important thing is to listen to your gut. Any disease you may have, for the most part, is really the root cause is in gut. Now there are exceptions to the rule, but we are making certain generalizations, because when there is 80 to 90% of people or 80 to 90% of diseases are coming from here, then that's basically what we generalize as. There are exceptions to the rule for the most part. So here, this emoji shows a a young person with abdominal pain in their belly. There is someone with fever, and you're taking medications. If you listen to your gut, you transform into a healthy person, and you're able to get off of meds. And that's the power of nutrition, lifestyle. May I ask you? Okay, thank you. All right. So I've had some experience in the last few years treating patients with lifestyle medicine and seeing their response and following them up for sometimes several years. And I'm going to share a few cases so that you get a glimpse of what's coming. So I had a patient who had Crohn's disease. Now, some of you may not have heard this disease, but those who have it, they or their family member know it very well. It's basically an inflammatory disease of your gut. It could be small intestine or it could be large intestine. It's a lifelong disease where you need medications, which are worth thousands of dollars per month for rest of your life, which also increase your risk for significant serious diseases, including cancer. And these medicines not even work 100% of the time, actually not even 50% of the time. And you have to monitor so many things. There are so many risk factors. So this patient was suffering from Crohn's disease for a really long time, several years, has had surgery. And now they were about to put her on this expensive medication, which you'll have to go and take IV every month or every 2 months and stay there for several hours, get infusions. I was like, she came to me, we sat down, we talked, we went over everything, came up with a customized plan for her. And in a matter of few months, she was not only symptom-free, but disease-free as well, just in a matter of 3 months. And we were able to not only avoid new medication, but able to get rid of previous medication. She was very particular. She followed through on everything. You cannot do stopgap method. That does not work. Another patient, 45-year-old female with chronic abdominal pain. The pain was going on for years. Like literally everybody had tried, even my mentor had tried 10 years ago to treat that. Constantly, no response. In 6 months later, 90% improvement. And I've had multiple such patients, but I'm just giving you a glimpse of what all things I've experienced in my practice. Another patient, 36-year-old male with chronic allergies, runny nose for decades, and it was not just seasonal, it was all year round. Constant medications, including steroids, antihistamines, inhaled steroids, all sorts of stuff, always drugged up. Finally, changed the lifestyle. 12 months later, 90% improvement. A few years later, he had to throw away all his medications because they were all expired, didn't need anything. Another patient, 38-year-old, new onset diabetes, high cholesterol, high triglycerides, and a few other issues. Always was happy. Oh, I never have any issues. And all of a sudden he gives me a call that I have so many things. My doctor said that I'll have to start 4 new medications. I'm like, how motivated are you to make lifestyle changes? He's like, I'm all for it. I'm going to do everything you ask me to. 6 weeks later, all his numbers were normal. Cholesterol went down 50%. No medication can do that. Off of all medications, didn't have to start anything, was much fitter, and diabetes was gone, everything was gone. So many other cases with many other different diseases. It is all possible, all if you listen to your gut. All right, let's see what that means. I'm going to list some of the diseases here so that if you have any of these diseases, you can relate yourself to this talk. But it does not restrict only to these diseases. Every other disease you can think of, you can potentially find a rationale here too. So I see a message about leaky gut. We'll talk about that at the end. That's a great question. We'll definitely go over there. Majority of the GI disorders have that background of leaky gut. So gastroesophageal reflux disease, inflammatory bowel disease, Crohn's disease, or ulcerative colitis, pancreatitis, constipation, diarrhea, gallstones, diabetic gastroparesis, one of the complications, dreaded complications of diabetes. Now, diabetes can be dangerous in multiple ways, but some of the issues are more lifestyle related, that your quality of life goes so poor because of these kind of diagnoses, and gastroparesis is one of them, where your stomach slows down, that whatever you eat just stays in the stomach and does not go anywhere. And you end up with serious problems from that. Irritable bowel syndrome, very, very common disorder. So these are some of the GI disorders that have enlisted here. Leaky gut, definitely we'll talk about it, but it kind of, is part of every disease you can think of. So how does that happen? How are you able to treat all these diseases? That's where you come talk about gut microbiome. So on the right side, you see picture of, your food pipe. If you see my marker, this is the stomach, small bowel begins. In the center, it's all small bowel, which is about 20 feet long. Then this is the large bowel or large intestine. It goes down into your rectum and anus. And on the right side of the body is this liver, big organ, very powerful organ. Right under there a little bit, you see gallbladder. So this is kind of a glimpse of your microbiome or where microbiome stays. So the point is, not all bugs are bad. We're always taught that if you see germs, if you see microorganisms, you see bugs, it's a bad thing. You need to use all the antiseptics and all sorts of hand cleanser, alcoholic cleanser, all sorts of stuff all the time. So not all bugs are bad. Never remember that part. That's very important. So microbiome is microorganisms that live in your gut. Majority of the organisms live in the large intestine. There are some in your small intestine, some in the stomach, a lot of the microorganisms are in your mouth, some in skin, but the major part that we're going to talk about is your large intestine. That's what we're going to talk about. There are about 100 trillion bacteria in your large intestine, 100 trillion. That's a huge, massive number. And we're just talking about bacteria, but there are fungi, there are viruses, there are other phages and all sorts of stuff in there. And they all work in tandem to either help you or hurt you. And how we're going to learn about that as we go forward. So just imagine this, 100 trillion bacteria. Total number of cells in your body are about 30 trillion. So total number of bacteria in your gut are 3 times the number of cells in your entire body. 3 times all the cells of your entire body. Think about that for a minute. The total weight of bacteria in your colon, if you put it all together, that may come up to 3 to 5 pounds of your body weight. There's significant number, significant weight that they carry. Now, here's more interesting part, the number of genes. A lot of the time we say, oh, my father had this disease, my grandfather had, my mom. So we talk about genetic disorders. We say, oh, my disease because my mom had gallstones, and that's why I have this gallstones. So let's learn a little bit about that. Human cells have about 26,000 genes. All right. You know how many genes bacteria has? 100,000. So number of bacteria is 3 times, and number of genes in bacteria 4 times our human cells. So 3 times 4, simple math, 12 times. So 90% of genes in our body are from these bacteria. So whatever you're saying, there are some extreme conditions that you cannot, you have it, just you cannot do much about it. That's less than 5%. More than 90% of your problems in your body are not because of your genes, but what kind of bacteria you hold and the genes from that. And let's see what these genes do. How are they so impactful on me? So genes from your bacteria are hurting you or helping you. Let's understand what these genes do. And of course, I'm assuming that you all know what genes are. Majority of you have heard of this, or they say, oh, it runs in my family. When we say it runs in my family, we're talking about these genes that are present in every cell of your body. So what do these genes do? We'll learn about it. Now, gut microbiome, these 100 trillion bacteria, they live in our body and they're supposed to be in harmony, symbiotic relationship. We help them, they help us. That's the relationship we have with them. If we hurt them, guess what happens? They hurt us. So genes produce chemicals. All the genes in our body and these bacteria produce various different chemicals. These chemicals could be hormones. You must have heard of the word hormones. There are certain digestive enzymes, there are certain enzymes all over your body. Neurotransmitters. What are neurotransmitters? It's a very difficult term, but neuro means brain, transmitters means signaling. So these chemicals in your brain, they're produced, many of them, through these genes from your gut. And sometimes nutrients like vitamin B12. Yeah, it's not produced from animals. Animals don't produce it. Microbacteria, these small bacteria produces B12, vitamin K, and so on and so forth. There are so many other things, so many other enzymes and chemicals that they produce, which are called metabolites that impact your health, make you strong or weak. So they could be messengers, they could be the director, they could be the workers, any of these. See, these chemicals, we are running on these different chemicals. Hundreds of chemicals are produced by these gut bacteria that really decide which way your body is going to go, how is it going to behave, how are you going to respond to lots of surrounding stimuli. So they're so very powerful. So these gut bacteria actually is the most important organ. Good chemicals, what do? They help us digest food. They keep you lean and healthy, improves your immunity, no infection, no autoimmune diseases. Actually, all the training camps for your immune cells in your body, majority of it occurs in your gut. They are trained to, follow the right, attack the right bad guys and keep the good guys safe. That's what they're trained in the gut. But if you mess up with that, the training system gets affected. You end up with autoimmune disease. Improves our response to medicines, vaccines, chemotherapy. So if you do all of these things right, if you eat right, if you have good microbiome, they not only keep you healthy, but they also make sure that the medicines you're taking actually work for you. They heal our gut, heart, liver, brain, really entire body. They're connected with every single organ in your body. What do bad chemicals do? Poor digestion. Many times you're saying, oh, my stomach is not feeling good. I don't digest well. Your stomach is trying to tell you, you've got to change your lifestyle. You've got to change your diet. They're trying to tell you, they're trying to protect your body by giving you warning signals. They make you obese. Yeah. I mean, of course, poor diet leads to bad bacteria and make you obese. Impaired immunity, we just talked about that. Impaired response to medicines, vaccines, chemotherapy. Inflammation leads to leaky gut. We'll talk about that at the end. Leaky gut. So why is the gut microbiome so very important? I'm going to give you some example. Have you noticed this? That some people eat so much but do not gain weight. They're like, man, that guy eats so much, but he never gains weight. Whereas I eat a little bit and I gain so much weight. It's because of the gut bacteria. This is a study that was done. An obese person's stool was taken. So stool has these bacteria in there, and it was transplanted in germ-free mice. Germ-free means just a mice which does not have any bacteria in it. And what happened to that mice? It became obese. Obese means fat, heavy, overweight. On the other hand, they used a healthy person's, lean person's bacteria, stool, and put the same bacteria in similar mice. And guess what happened? Same food was fed to this mice as well, but this mice stayed lean. So your body fat is because of the microbiome that you're carrying. The bacteria in your gut are playing a huge role in that. Actually, I've had cases where a kid was hospitalized, was very lean and never was overweight, how much ever he could eat. And in the hospital, they got some antibiotics for some disease. And at the end, we realized that was not even needed because it was a viral infection. But guess what happened after that? That kid later on became obese, and anything and everything he ate, he just kept on growing weight and became overweight very, very easily and very fast. The kid who was never able to put on weight now ended up putting so much weight on, all because those good bacteria got killed by taking antibiotics. Another important, just to give you a glimpse, serotonin hormone. Has anybody heard about serotonin hormone? Well, it's a hormone that makes you happy, gives you satisfaction, gives you optimism. Yeah, it's this hormone, not the gifts, not the vacations, not the movies. We think that that's what's giving us happiness. Is the chemical, this hormone that is giving you happiness, satisfaction, optimism. Where is it produced? You probably guessed it by now. Not in the brain. We think it's in the brain, right? We always think, oh, happiness must be related to the brain. That's what I think. But no, 95%, not 50%, not 10%, not 20, 95% of this hormone is produced in your gut by these bacteria by breaking down healthy foods. Just imagine, if you're not putting healthy foods in your stomach, your bacteria cannot break it down into producing this hormone, and you will feel depressed, groggy, fatigued, tired, not very, enthusiastic or excited about doing things. It's this hormone. So it's not you are what you eat, you are what they eat. Who's they? The gut microbiome. What they eat is what you become. So you want to make sure they're fed healthy food so that you become healthy. All right. So I gave an example of stool transplant. We talked about a little bit. So what is stool transplant? What does it do? Ulcerative colitis, your colon becomes inflamed. If you don't know about it, that's a good thing. But I treat these kind of patients who have inflammatory bowel disease, and ulcerative colitis is one of those types where your colon, large intestine, becomes inflamed, and it's like Crohn's disease. They require medications worth thousands of dollars for years and years of their life, unless they completely resect, completely remove their entire large intestine and have a bag or have your small intestine connected to your anus, that kind of situation. So all these patients, ulcerative colitis, were given stool transplant from a healthy person. Now, healthy person is a definition, it's a relative definition where a lot of people struggle with defining who's healthy. We can define disease very well, but we cannot define healthy as well. Because just because you're not taking any pills or you don't have a diagnosis, that does not necessarily make you healthy. There's a healthy person and there is diseased person, but there is a big gray area in between. So it's always a challenge defining healthy person. Just imagine. What happened to these patients? After they received the transplant in a matter of a few weeks, some patients completely were able to get rid of medications, completely resolve their symptoms. Some patients had partial improvement and some did not have any impact, but majority of them actually showed some response. They did another experiment. Lean mice were fed artificial sweeteners. We think, oh, I have diabetes, I'm not going to take sugar, but I'll go for artificial sweeteners. They're sugar-free. What happened to those mice? Those mice ended up with diabetes and obesity just by taking artificial sweeteners. So it's not just the sugar, but the kind of food that you put in also plays a role. So artificial sweetener, which is not getting absorbed in your body, but these gut bacteria are consuming it, and then you end up getting diabetes and obesity. What they did was they took the stool of this obese diabetic mice and fed to the lean mice. And guess what was the outcome? That mice became obese and diabetic also. They gave stool from happy patients to a depressed patient. What happened in depressed patients? A lot of them became happier and their depression either decreased in severity or even got better. So that shows us that gut microbiome can be so powerful. These are just examples. So we always say, what are the plant you want to grow, right? Whenever we're talking about kids, we say, encourage the positive aspects, positive things, so they grow and learn the right things, and we ignore the negative things. So always, what are the plant you want to grow? Here, you want to feed the bacteria that you want to grow. And of course, you want to feed the good bacteria. So you always want to remember and know what's the right diet so that these bacteria, good bacteria, can grow and you can be healthy. And remember, good bacteria and bad bacteria you can change the proportion of good bacteria to bad bacteria and bad to good very easily. So you have to be very, very sincere about your diet. You fall back, you revert back, you do stopgap method, your bacteria quickly reverse back to bad commensal bad group and start giving you bad chemicals. So you have to be consistent with your diet and lifestyle. So healthy gut microbiome, it's the secret for good physical and mental health and secret to reverse your disease. Let's learn a little bit about healthy gut microbiome. I told you we have a little bit of difficulty in scientific world to define what is healthy, but we're going to go with the most common definition that is being used in today's day and age. So there are about more than 1,000 species of bacteria in our gut, 1,000 different bacteria in our gut, and some of them are pretty dangerous, that if they are in our blood, we consider that serious infection. But if you have more different kinds of groups, more diversity, that means you have healthy gut microbiome. As you start eating bad food, this diversity starts going down. and you have less number of species and more the bad chemical producing species. And that's where you end up from being healthy to unhealthy. What do they thrive on? What do they love? They love fiber. Fiber deficiency is the most common deficiency, nutritional deficiency in America. With all the social and economic progress that we have done here in Western world, one of the problems that we are facing is, we don't have high fiber diet. We end up with a lot of processed food. And even if you're vegetarian, you still may end up with unhealthy food with less fiber. So we're going to learn about that. Ideally, you should be eating more than 40 grams of fiber per day. And if you look at your diet, you will realize you're way far behind on this number. Ideally, if you're at 60 grams, 80 grams, it's even better. They did this study in Africa and they compared the fiber intake, and that results in stool proportion. And it was so much different than African Americans in America versus African people. And they realized the disease proportion was significantly different. Their stool proportion was higher. They were eating more fiber and they were disease-free. Whereas here, they were eating lots of fiber-free processed and animal protein and ended up with lots and lots of diseases. Some diseases were like 100 times more, 200 times more, 300 times more. That huge of a difference. So low-fat, whole foods, plant-based diet is what they thrive on. They love that diet and they produce good chemicals and make you healthy and happy. So what does it mean, low-fat, whole foods, plant-based diet? You're, of course, on Komal Rastogi's nutrition class. So you get the education on what's the right diet. So I'm going to just mention those names. I'm not going to go in detail because you get that training here. So fruits, vegetables, whole grains, seeds, nuts, that's basically what covers whole foods, plant-based diet. Now you may have fruits which are in, you may make a juice, you may take fruits in different kinds of forms. But that's not whole foods, plant-based. You have to take the entire fruit and eat it. So I'm not going to spend too much time on low-fat, whole foods, plant-based diet because you're getting special course, you're joining this class. You're going to learn a lot about that from Probiotics. What are the other ways to make the gut microbiome even healthier or support? Now, major part is your diet, but does that end there? No. You have to have some other things along with that. Exercise, very, very important. Now, exercise itself, how should you do? What all things you can do? There's a lot of things to talk about. But if you're doing nothing, just start doing whatever you like. Be it walking, be it running, be it swimming, whatever you like, just start. Okay. Once you're into the process of doing it for a few weeks, then we can always customize and go further and learn more about it. Circadian rhythm, sleep cycle. Just like you should sleep on time, your bugs also like to sleep on time. If you don't sleep well, you're groggy, irritable, you have all sorts of issues, you cannot focus, you're driving, you don't feel safe, you're slow when you're working. All these things happen when your sleep is disturbed or you're not sleeping well. And same thing happens to the bugs in your body. If you sleep, bug sleeps. If you don't sleep, bugs don't sleep. And then the bad chemicals start generating. Your good microbiome turns into bad microbiome. So sleep is very sacred. You have to treat it properly. There's a lot of criteria that you got to follow to make sure that your sleep is perfect, or at least as close to perfect as can be. But maintain a time cycle for your sleep. Stress management and mindfulness. Now, your gut microbiome will learn that produces serotonin hormone to make you happy. But if you're stressed out about certain things, that can negatively impact your gut microbiome, make it bad. So you want to work on stress management as well. Being mindful. Mindfulness is a very common thing nowadays. A lot of people are coming up with different kinds of ways to educate you on mindfulness. So stress management, very, very important. Another important part is healthy relationships. You should have healthy relationships with so find good social circle where you are comfortable with people around you, and volunteering. Now, volunteering is very, very helpful. When you help others, your body releases certain chemicals which are truly helpful for your own body. But remember, volunteering comes with a star there. That means you should not have any expectations in return. If you volunteer and you're like, oh, he did not even thank me, he did not show any gratitude, he or she, whatever. If you're doing that, that's going to actually make your gut microbiome worse. So if you're volunteering, be clear in your head. You're doing that for your own sake, your own self. If you start doing it that way, the chemicals that are released in your body will actually heal you and help you. So be mindful about that. Now, this is something not in your hand, but we've noticed there's a lot of data on that. Somebody who goes for C-section versus normal delivery, the baby which is born in normal delivery has much better microbiome versus with C-section, they don't have that cesarean section. They don't have that microbiome exposure, and they're coming up with different methods. But even if you're born as a cesarean section, don't lose hope. Things can still change later on. But just giving you an idea that you will see that a lot of babies who are born with cesarean section end up with a lot of different kinds of allergies and much worse than the other kids. It's so very important for the kids and for adults to be outdoors with nature. There's a lot of data that if you're with nature, your microbiome is much better versus if you're always inside your house or office and using all sorts of antiseptics and antibiotics and all sorts of anti-bug germaphobes, you will lose your good bacteria too. So be mindful about that. Unhealthy gut microbiome. So animal products, dairy products, milk, cheese, butter, yogurt, candies, name it, and everything that has any dairy product that's good for your microbiome. It's bad for your microbiome, not at all good. Cheese is very popular. Everybody thinks it's so healthy. Absolutely not. Very, very bad. No dairy products. Eggs, bad. Meat, red as well as white. People say, oh, white meat is okay. No. Fish, all kinds of refined and processed foods, including sugar. Yeah, the white sugar that you have, refined food. That is a refined and processed food. Oil, packaged, processed foods, artificial flavors. All of the, whenever you see a food product that has artificial flavors, some kind of natural flavor, some kind of number written in there, or the names that you don't know, that actually does not grow on tree, but it's an extract or something that's a processed food. So all of these are zero in fiber. They have no fiber in it. All of these things have no fiber, and good microbiome cannot survive. Bad microbiome, bad bacteria thrive on this. So also, these kind of foods have longer transit time. Fiber, what it will do is it will, facilitate the transit of food throughout the gut much faster compared to these kind of foods because it doesn't have fiber, and it stays in your intestine, which is large intestine. A small intestine is 20 feet long, large intestine is 10 feet long. So this journey lasts much, much longer if you are eating these kind of food products, and these food then rot and ferment in your gut, and they create all sorts of bad chemicals. Whenever something is rotting, it's fermenting, it's producing all sorts of, you feel bloated, gassy, and all sorts of bad chemicals are released in your body. So increases your inflammation, ends up with leaky gut, risk to catch more than 80% of all the diseases that people. So antibiotics, I just explained how it hurts your microbiome. Addictive substances, tobacco, alcohol, caffeine, all of the addictive substances are hurting your microbiome. Poor sleep pattern, we discussed earlier. Lack of exercise, again, bad for your microbiome. Stress and cesarean section, as we discussed, I'm just giving you the opposite side. What is bad for your gut microbiome? So GI disorders, bad microbiome increases the risk for GI disorders, mental illness, immune disorders. We talked about how the cells work, infections. If your gut microbiome is strong, you're more resistant to all kinds of infection, even cancers. You can prevent lots of different types of cancers. You can even help, improve the response to chemotherapy if you just change your diet. It's never too late. Skin disorders, a lot of simple disorder. People say that, oh, they have lots of, pimples and all, and I've had patients, young girls who are in college, they went on whole foods, plant-based diet purely for this reason, because their skin starts glowing if they go on this kind of diet. And this is a side effect, a good side effect of going on this kind of diet and lifestyle. Heart disorders, diabetes, high blood pressure, high cholesterol, you name it, brain disorders, every single disorder will start coming in some or the other form. Everybody has some good genes, some bad genes, but this is the trigger to activate or stop them. So healthy diet will stop all the bad genes from coming into action. So is stool transplant the solution? I showed you some slides about stool transplant. They take stool from healthy person and transplant into a sick person. Is that the solution? No, unfortunately not. Certain infections have shown a pretty good response by doing stool transplant, but only certain infections. It carries its own risk. So you cannot just do that and everybody for every disease. And plus, you get it in a few weeks of, if you do not feed the bacteria that you want to grow, they revert back to bad bacteria. So very important that you change your lifestyle. There is no shortcut. So this is the summary of what we have learned. This is the most important slide that kind of shows you exactly what you should do. And everything is overlapping with each other because everything is interconnected. You mess up one thing and you will see the domino effect with everything else. So for healthy gut microbiome, you need whole foods, plant-based diet, which should be low fat, exercise, sleep, proper sleep, de-addiction, stress management, mindfulness, social connection, volunteering. All right. What else? Now we learned about the lifestyle part. Of course, there's a lot to talk about, but I'm giving you a bird's eye view of everything so that you start looking into these things. But is there anything else I can do in addition to all the things that we talked about? Yes, you can. Abdominal breathing, such a simple thing, but yet so very powerful. What is abdominal breathing? You must have seen all the babies. You must have seen babies at your house. All of you probably have come across and see how they breathe. Just observe. You will notice that when they take the breath in, when they inhale, their belly comes out. What happens is, as we grow old, we don't want anybody to see our belly. So what we do is we start bringing our chest out and pull the belly in every time we inhale because we don't want anybody to see our belly. And that's one of the worst things we can do for our body. Such a simple thing. Just switching back to normal ways. When you inhale, and I want you to all try right now while you're watching. It's an easy thing you can do while watching it. So when you inhale, try to keep one hand on your chest, one hand on your belly, and take a nice deep breath. Inhale. And check which hand is going up. Make sure your belly is going up. If your chest is going up, that's a wrong way of breathing. Correct it. When you inhale, belly comes out. When you exhale, belly goes in. So abdominal breathing. It activates your parasympathetic system. It's a nervous system that is, its function is to rest and digest. So your body goes into a resting state from a flight or fight mode. So your stress starts going down and your digestion improves. And there are multiple other benefits. Lots of diseases start going down just by changing this simple thing. So abdominal breathing is very, very important. You can do this every single moment of your life. Does not require any other changes, changing how you breathe. Second thing, intermittent fasting. Just like, our car needs a brake, you cannot keep driving it. All the machines need some brake. Our body is a machine that needs a brake too. Our stomach needs a brake too. So for 16 hours, you should not put anything in your stomach. Let the stomach heal, repair, get better in that 16 hours. So it will work with, a lot of energy for those 8 hours when you eat. So 10 a.m. to 6 p.m. you can eat. And after 6 p.m., don't eat anything until 10 a.m. again. So you will get 16 hours of break. Now you can slowly start from 12 hours, then go to 13, 14, 15, 16. Some people like to go to 18, 20, even 23, and that's fine. Everything is fine based on your energy requirements, but at least 16 to 8 is something we should strive to do all the time. It has tons of benefits. Third thing, so limit the food intake. All right. There are lots of these pockets in the entire world where people live really long life. Majority of the people live for like 100 years, 110 years. There's some areas in Japan, some areas in California, some in Europe, some China. So they've found lots of areas where people live for more than majority of the population lives to be more than 100 years old. And they thought it was all genetics, but they realized genetics played a role in about 20% of patients or 20% of people who live there. 80% did not have anything to do with their genetics. It was their lifestyle. And one of the key things that they noticed was all of them ate only when they were hungry and less than 80% of their appetite. Some only 60% or 70%. Just look at this washing machine. Do you ever fill it completely full? You don't. Your clothes will not be washed. You make sure that you fill less than that level that is in there. Similarly, your stomach, if you fill it completely, it's going to stop working. The food is just going to sit there, it's going to rot, all sorts of bad chemicals are going to be released, and you're going to be groggy, not happy, and diseases will start coming in. Acid reflux is one of the instant problem that you start feeling when you start overeating. I've had so many patients who's like, oh, I used to love to go to these places where all you can eat is offered. And they just go and stuff themselves. Oh, my wife loved it when I did that. And it was such a competition, I used to do it. What happened at the age of 30, they'll have all sorts of bad GI problems. And many times it's so late that we cannot even fix it. So make sure that you do not overeat, okay? Very, very important. 80% of your appetite. At 80%, you're perfect. More than that, you're going to be full, not happy. You need to lie down, relax, all sorts of issues. So these are the certain things we talked. We got a bird's eye view about different things. The resources, there are plenty of resources out there in today's day and age, but these are some of the websites which you will even find on namastearogya.com by Rastogi's. There are certain books. This is an app for the doctors in the group. PCRM Nutrition is a good app for doctors. Daily Dozen is a good app for everybody. And there are certain books you can go to. There's lifestylemedicine.org, which covers all 6 aspects of lifestyle medicine that I talked about. So these are things. A little bit about leaky gut because it was brought about. Our gut, the cells in our gut, large intestine, have very tight junctions. All the cells are tightly packed. There's no gap in it. And on top of that, there's a thick layer of mucus which protects this gut from trillions and trillions of bacteria above it. Now, what happens is with bad bacteria, with bad food, this thick layer of mucus, which is kind of formed by breaking down fiber. This thick layer of mucus, protective mucus on top of your cells, is formed by breaking down fiber. So if you don't have fiber, you don't have that product that is formed by breaking down fiber called as short chain fatty acids. There is butyrate, propionate, acetate. They're not going into too many details. I don't want to. But basically, there's a thick layer of mucus, which is formed by breaking down fiber. If you don't have fiber, this layer starts thinning out. Plus, bad bacteria start releasing bad chemicals. What happens at the end? Our tight junctions in between cells start becoming leaky. They were so tight, they were not letting any bad stuff go in there. But now it starts become leaky, impaired tight junctions. The tight junctions are impaired now, and all the bad stuff can enter now. Now, our immune system was very smart. It was only letting certain things in. It was training the new immune system cells. Our gut was very smart in training new cells. But when it becomes leaky, all the bad stuff starts going into our gut as well. And what happens is our immune system now sees these bad chemicals. And sometimes these chemicals look like our own cells in our body, our own cells. So the immune system attacks that bad chemicals, but it learns that anything that looks like this is bad, and then starts attacking our own cells in our body. And that's one of the ways that you end up with lots of autoimmune disorders. That's one of the ways that you will end up with lots of abdominal pain issues and many other diseases, because all these bad chemicals start entering in your gut. That's called leaky gut syndrome. All right. So that was the leaky gut part. Thank you for your attention. I see lots of questions are coming in, and I'll answer one by one. Feel free to ask. So the fiber supplement powder, that question, let me answer that first. That's the easy one. So, one of the questions is it good to take fiber supplement powder? Well, anything that you extract out of something has lots of issues. Now, it may help some. I do give fiber supplement to somebody who's acutely ill with some problem. Let's say they have constipation. Then in that situation, I'll give them. But again, it's a short-term solution. Plus, it's not giving you the entire benefit that you would get from it. So I don't completely say that, oh, you shouldn't take it. When you need it, you can take a little bit. But mainly, if you change your diet, you make your diet fiber rich, then you will start seeing the results, not just from your GI system problem, but overall your health will start getting better. Now, your question was hiatal hernia and how can we naturally repair it? So generally, whoever asked this question, natural let's see, we'll go to the hiatal hernia. I think the hiatal hernia question comes with acid reflux disease. Generally, they say that patients tell me that I have hiatal hernia, and that's what I was told. And whenever, that's because why I have acid reflux disease, right? And I assume that that was your question. You asked about hiatal hernia because acid reflux disease is such a common thing. More than 10 to 20% of the population, even 30% of the population suffers from acid reflux disease. What do you feel at that time? You feel burning sensation in your chest or sour taste in your throat. Sometimes you have nighttime cough, runny nose issues, bad dentition. Your teeth becomes very, you lots of have dental caries and dental caries because this acid keeps eroding into your enamel of your teeth, and lots of other such problems, throat clearing. So acid reflux is a big problem. Hiatal hernia mainly happens because you're not breathing right. I taught you about abdominal breathing. If you start doing abdominal breathing, I have seen 5 centimeter hiatal hernia goes down to 2 centimeter or even smaller. I've had that experience with treating my patients, and they were really sick. Their esophagus food pipe completely stopped working. And even then, I had such an amazing result. They're pretty badly inflamed esophagus food pipe and started getting better. But there are other things you can do. Besides abdominal breathing, there are certain exercises you can do to ensure that diaphragm kind of closes. I'm trying to be as simple as possible without taking too many medical terms, but your chest and your belly is separated by diaphragm. And whenever diaphragm contracts, it comes down and comes out. And that's when your lungs fill up with air. But there are pressure changes that are happening in your chest and pressure changes that are happening in your belly. And that's where the food pipe either goes up or stays down. If food pipe and stomach both go up, then that's really called hiatal hernia. The stomach, which is supposed to be in your belly, if it starts migrating upwards into your chest, that's called hiatal hernia. That's because a few reasons. One is abdominal breathing. Instead of abdominal breathing, you do chest breathing, and then you end up with worse hiatal hernia. But you do abdominal breathing, your hiatal hernia improves. Second thing is you overeat, and the sphincter starts becoming shorter and shorter. It's generally 4 to 5 centimeter in size. You keep overeating and you balloon up. When you blow up a balloon is tiny, right? You blow up and then a huge balloon is formed. But still at the top, you'll see that a big area that is not blown up yet. But you now keep blowing up to the brim, and then you see that the last part also now opens up. Same thing happens with your stomach. You overeat and it opens up. And now that protective sphincter is not there anymore. Acid reflux happens and stomach also starts going up. So that's for hiatal hernia. There are exercises you can do. You can Google it. Some physiotherapists actually educate on that. But abdominal breathing is one of the most important things you can do, and avoid overeating. These are the two things. Now for acid reflux itself and the complications from it, I'm going to talk about a few things that can help you with that. Of course, no question about it. The 6 things that we talk about to help you overall get healthier will also help you in ensuring that you don't have acid reflux disease. So diet should be low fat, whole foods, plant-based diet. I've seen patients drink soda. Soda is pure acid. You drink soda and you're going to end up with acid reflux disease. They're like, I have soda once in a while. Then you get into details and you realize they're drinking much more often. Every time you drink soda, you're going to suffer from acid reflux disease. Caffeinated beverages, the caffeine will open up that sphincter, you'll have reflux. Peppermint is otherwise good, but somebody who has acid reflux should not have mint products. If they have mint, their acid reflux is going to get worse. Fatty meals shuts down your stomach. Stomach sends a hormone directly to your brain and tells, I got fatty food in my stomach. I need time to digest. Let's not push the food from stomach into small intestine. So if it's not going to go downwards, where is it going to go? If you keep filling it up, it's going to go back up and you're going to have acid reflux disease. Now, for all the Indians, tur dal, yellow split pigeon peas. The tur dal is also very acidic. So I recommend my patients to avoid eating that in the evening time. These are some of the specific, do not overeat. I cannot put more emphasis on that. Avoid eating or drinking after 6 p.m. If you sleep, your gut sleeps, and your stomach needs about 4 hours to digest whatever you have eaten in the evening. So keep your evening meal light And do not eat after 6 p.m. Now, do not drink either after 6 p.m. That's one of the important things. Do not eat or drink, even water, I would say, do not drink after 6 p.m. Wait, water? I can't drink water? So back in the day, people used to drink well water. pH of well water was about 8.5, 9. Now with all the chlorination and all the pesticides, coming down and all sorts of chemicals, the pH of water has gone down to like 5 or 6. Some patients will come and tell me, this specific brand mineral water, whenever I drink, my acid reflux is worse. Some patients will do all sorts of life changes, but they'll still have acid reflux disease. And my first question is, how much water do you drink at night? Oh, I drink 2 glasses. I was told that drinking water is good for you. I drink 2 glasses, 3 glasses. That's your problem. You should not be eating heavy, should not be drinking water at all. If you're very thirsty, you can have a few sips, but eventually your body will get used to it. In the daytime, you can drink plenty of water. And avoid drinking too much of water with food. Drink in between meals so that it will help flush out your system. So do not drink or eat. There are alkaline water available. You can use that to, somehow negate the effect of that bad water. So you can put your water through alkaline water filters, and that can help you. Now, remember, there are issues with alkaline water filters as well. So try to stay as natural as possible. There are certain expensive filters out there which will take out all the bad chemicals, put some healthy minerals in there, and maintain the pH above 7, 8, or about 8, 8.5. And that can be good for you. Avoid laying down for 3 to 4 hours after eating. Sometimes we overeat, and guess what happens after overeating? I want to lay down for a little bit. I can't walk anymore. And there, your acid reflux is going to get activated. You're going to have pretty bad reflux. So, of course, dietary triggers you will identify, but these are the other things you can potentially do. Exercise is important. If you don't exercise, your gut does not move, you end up with acid reflux. Weight loss, if you have a huge belly fat, it's going to squeeze your stomach. And whenever you squeeze a balloon, what happens? Stuff goes up or down. And the stuff that comes up is acid reflux disease. Your hiatal hernia also occurs because of belly squeezing. And hiatal hernia is associated with acid reflux disease. Sleep is very important. Poor sleep, worse acid reflux disease. While you sleep, make sure you raise the head end of your bed by 30 degrees. You can use veg pillow. You can Google veg pillow and you'll find, or you can raise the head end of your entire bed. Your entire bed goes up by 30 degrees. Your head is on this side, leg is on this side. And that water does not travel uphill. Similarly, acid also cannot travel uphill. So raise the head end of the bed. Sleep on the left lateral side. When you're sleeping, sleep on your left side. That will avoid reflux. That will decrease reflux. If you're sleeping on your right side, your reflux is going to be worse. The addiction, smoking, drinking, caffeine, any of that is going to make things worse. And abdominal breathing. So these are the things that you can do in addition to all the things that we talked about earlier to help with your acid reflux disease. Majority of my patients to treat acid reflux disease are doctors, because they don't want to go on medications. But guess, patients, what do they like? They want medications from the doctors. So you want to get rid of medication and get rid of disease, focus on your lifestyle. All right. Now, there was a question about probiotics. We have restricted time, but I'm going to try to go over some of the things as quickly as possible. Now, probiotics, unfortunately, you cannot probiotic your way to, I assume you can see my slides, right? You were able to see acid reflux slides? Okay, so probiotics, there is something called as prebiotics, there is something called as probiotics. So we'll learn about prebiotics. Prebiotics are complex indigestible fiber. So there are these fibers, they do not get digested, and they're the food for good microbiome. We all should know now. We've spent a lot of time learning that. They're the key for stronger digestive system. You should have rainbow diet, means different colors of food. Go to the produce section. If it's a different color, pick it up. Different color, pick it up. You should cover a rainbow. So if you're taking 7 different colors, you're getting all sorts of nutrients and all sorts of different fibers in your diet. Prebiotic is the food for actual microbiome. Now, what probiotic thought process behind probiotic is, there are certain good bacteria in your gut and certain bad bacteria. But if you're bad bacteria in high proportion and good bacteria in low proportion, let's buy some of the good bacteria and put it in my system. I'll just eat them and I'll have good gut microbiome. Unfortunately, we are not there yet. Now, it works in some patients, in some cases, but for the majority, it does not work. I have no problem in trying it. I tell my patients, give it a try. for 6 weeks. If it works for you, wonderful. For the majority, it does not work because there is no shortcut. There is no shortcut to success. You have to work hard. You have to put in the right stuff. We cannot be cheating on our diet and expect the probiotics to do our job. You cannot outsource your health. You have to work on your health, and to be healthy, you have to put in that effort. So different types of bacteria, there are biotics too, certain bacteria which will produce certain chemicals, as we saw, and make you happier. So there are certain these things, but it can be in addition to your lifestyle changes. It will not be the solution for your problem. It will be helpful to add on. And if you try it, it doesn't work, stop. I mean, don't spend your money. It's not worth it. And there are so many different combinations out there. Plus, they can carry risk of toxicities. Sometimes they're not pure. So be mindful what you're buying, and just check the reviews. Unfortunately, VSL number 3, that is the only probiotic that has been researched very well. Now there are a lot of research coming out, and even COVID was associated with having healthy microbiome. Those who have healthy microbiome, they're able to suppress the COVID bacteria 90% of the time. It's just incredible. Postbiotics. So truly, we are eating prebiotics to make healthy probiotics, because that will make postbiotics. What is postbiotics? It's nothing but the chemicals we talked about earlier. It's called metabolites. These are all fancy words we use, but in simple terms, it's just the chemicals that these bacteria produce. So our true goal is making these metabolites. And guess where the industry is going? Pharma industry is focusing on making these chemicals so that they can sell you as tablets. But you have it right at home. Just go to the produce section, make sure you take healthy food, change your lifestyle. You don't need any of these things. But that's the benefit, all right? COVID-19 and microbiome. This study, there are multiple such studies, but this study showed that 3 different chemicals from your gut produced by bacteria inhibit COVID 90% of the time. How powerful is that? I'm going to look at the questions. We're running out of time, but I'm going to try to see how to get alkaline water. You can buy it online. Which brand of water ionizer is recommended? I do not recommend water ionizer. I recommend these filters, which will extract all the chemicals out of it. And then they have certain other 7-layer, 10-layer filters, and then they will put in some healthy minerals in there. I haven't found a perfect combination, but there are a lot of good ones out there. Expensive, but that's something you can use. Can anyone drink alkaline water after 6 p.m.? Same thing. You may not get 100% effect. So I would recommend that you can drink alkaline water, but a few sips of it. Do you have any tips for improving sensitive stomach and reduce onset of stomach bugs and nausea? All right. So the sensitive stomach part, I spent a lot of time talking about acid reflux and how it behaves. Gastroparesis also is kind of like that. Plus, what happens in sensitive stomach, the leaky gut comes into play. All sorts of processed food have these chemicals. Even your dishwasher liquid, dishwasher liquid, there are certain kinds of chemicals out there in that dishwasher liquid that is very harmful, that increases your allergies, that increases your sensitivity. You go out and eat Chinese food, and you will see that certain Chinese ingredients that you get in restaurant will actually cause your stomach to be sensitive. So if you go on low-fat, whole foods, plant-based diet strictly, you will see the sensitivity starts dropping down. If you start working on these things, now remember, we have abused our digestive system for decades. So it's going to take some time. You're going to have ups and downs, 2 steps forward, 1 step back. So just because your symptoms got worse one day, don't assume that whatever you're doing is not working. Assess how bad your symptoms were, write it down, and then keep track of it. You will see a trend towards betterment. There will be some bad days, but the number of bad days before were much higher. Now they will start going down. You have to give it a few months, and in a few months' time, you'll start seeing excellent results. Generally, I see within 6 weeks, I start seeing improvement, significant improvement. Some start in 3 weeks, and their labs and everything start improving. White patches in skin, is this related to autoimmune leaky gut? Do you know if people have reversed with whole foods, plant-based diet, and fiber-rich diets? Now, I don't know, white patches could be due to lots of different reasons, but one of the things is you focus on this diet. In addition, make sure your vitamin D levels are good. Make sure you go out in sunlight for optimal period of time. Don't overdo it. Don't be in the sun for hours and hours, but make sure you are exposing yourself to the sun every day a little bit. That also helps your sleep. That also helps your brain to understand the circadian rhythm. Brain will know when's the daytime, when's the nighttime, because we have all sorts of lights in our house. So brain is all confused. Eyes are all confused, which is day, which is nighttime. So you have to make sure you go out in the sun, get good sun exposure, and that will help with your skin diseases. Make sure you have good vitamin D levels in your system. Make sure you lose your weight. Now, white patches, if they're due to psoriasis, we have learned that if you lose weight, your psoriasis improves. I've had patients, when they undergo some surgery, they lose weight, they're like, doc, my psoriasis improved. And that's when I went back. How did that happen? And so there's plenty of research out there. You lose weight, your psoriasis improves. You go back on healthy diet, your psoriasis improves. So white patches could be due to lots of different reasons. So, making sure this will cover lots and lots of course, there are 5 to 10% of diseases that are truly something that you cannot do just the diet part. You have to do other stuff as well. And that, again, need to have discussion one-on-one. Yes, acid reflux also can result in coughing when eating. All right. I'm going through the questions. There are plenty of questions here. Can you give any preferred water? Do you have any suggestions, supplements to reduce gas? Now, gas, bloating is one of the things that bad diet will result in. More fermentation, more rotting, more gas. But one of the things that you want to be sure is that try and avoid eating fruits with anything else, be it whole grains, be it nuts, be it seeds, be it beans, lentils. Fruits get digested real fast, and the other stuff takes some longer period of time, right? So if by the time other stuff is getting digested, the digested fruits start rotting and fermenting, and then start producing gas. Some of the foods are high in fructose, and that can also cause gas. So you want to be moderate. People say, I do everything in moderation. Don't do bad stuff in moderation. Bad stuff should be completely out. And the good stuff, the healthy stuff, should be in moderation. So if I eat fruits, should be in moderation. If I eat healthy whole grains, should be in moderation. Do not overeat. Remember, healthy stuff, overeating is not a good idea. Obesity, I'm going to go over, I know we are 5 minutes over. I'm going to take extra 10 minutes and try to wrap this up so that everybody gets a chance to look at some of the. Now, the question is, how do you know when you're 80% full? It's a tough question. It's very subjective. Ideally, body is to tell us, but we've learned to ignore the signals from our body. And that's why we have this question, how do we know we are 80% full? So we have to start, assess how much you were eating before. And after your food, do you feel lazy? Do you feel groggy? Do you want to lay down? Are you slow? All of that means too much of blood supply is going to your gut. You're overeating. Start cutting down and try to find an optimal way where you don't feel hungry afterwards and you are like not lazy. So you have to give a little bit of trial and error to figure out what's the right diet. Now, you're going to learn a lot about obesity here from Komal, but I'm just going to show. If you see 400 calories of oil in your stomach, just occupies this much space. 400 calories of chicken takes this much of space, whereas 400 calories of vegetables will fill the entire stomach. So not only you're giving healthy stuff to your body, but you're avoiding bad calories too. So multiple benefits of going on whole foods, plant-based diet in terms of diabetes in terms of restricting calories. So high fiber diet is less calories. It's low fat diet. In obesity, make sure you do some resistance training too, not just cardio, do some resistance training, build those muscles up. That's very important. And do your stretches, do yoga. And Sapna is providing us this resource here along with Komal. So we've got amazing pool of volunteers who are helping us out here. Proper sleep, as we discussed, and stress management. All of that goes in the addiction for obesity. We talked about GERD. Let's see other important stuff. There's insoluble fiber and there's soluble fiber. Those who are constipated should go with insoluble fiber. And those who are, those who have diarrhea problem, they should go with soluble fiber. Soluble fiber absorbs water. So if you have diarrhea, you will have formed stool. And if you have constipation, you need to bulk up your stool. So you need insoluble fiber. And what it will do is it will absorb water and provide smooth passage of stools, and your constipation will get better. Not only that, your cholesterol will get better, all sorts of problems will get better. And we talked a lot about healthy microbiome and its results, and all thanks to fiber. So make sure you eat And this is one of the slides that I got from internet from Better Cells, but there are plenty of resources out there to find what is the healthy. Now, those who have pancreatitis, it's the same recommendations, really, but it's very, very important. One of the things that, in addition to our 6 things that we talked about, is chew your food thoroughly. Your pancreas are very, very important in digestion, but your salivary glands in your throat, they produce similar enzymes like pancreas. So if you chew your food properly, grind your food properly, and generally our food is designed, we are designed to be herbivores. So if you eat those plants and vegetables and chew your food thoroughly, the digestion begins in your mouth and not in your stomach. And your stomach feels very comfortable because half the job is done and it doesn't have to work that hard. So, our grandma used to say, chew your food 32 times. There was a reason for that. Constipation, insoluble fiber, prunes and kiwi. Prunes work wonderfully. 2 kiwis a day also help. Plenty of water. Fiber is useless without water, so make sure you're drinking plenty of water. Now, plenty of water is when you don't feel thirsty and you're not going to the bathroom every 15 minutes. So you have to find a balance in between. So try it out for yourself. Make sure while you're moving your bowels, you're in squatting position, like, your knees are raised up. Bring the stool to raise your legs up so your knees are bent. Hip is bent. That's the squatting position. Lean forward. Keep your back straight. That will press your belly. All of that will help you in resolving your constipation. Do abdominal breathing. Abdominal breathing is going to change that pressure, and you're going to have better bowel movements. And check your medications. Many times, even over-the-counter medications, sometimes the supplements, they can constipate you. So sometimes we go, oh, this is healthy supplement, it's good for you. But that can also cause constipation. So be mindful of that. Exercise, very, very important. Only if you move, your gut moves. If you stop moving, you're lying down and laying in the couch all day long or in the chair, your gut is also going to do the same thing. Whenever you have the urge to go to the bathroom, make sure go to have number 2, bowel movement. Go right away. You're like, oh, let me watch this serial and then I'll go. Or let me finish this thing and then I'll go. You're sending confusing signals to your brain. Your brain have no idea now. When I get this signal, should I go or not go? And the gut, your rectum stops sending these signals. And then you're all confused. Your body's confused and you don't have regular bowel movements. So make sure whenever you have the urge, you go within a matter of few minutes. When you go to the bathroom, if you're constipated, don't stay in there for more than 5 minutes. 5 minutes. If you're not having a bowel movement, get out of there. No cell phones, newspapers, anything in there. People have this bad habit that they'll sit in the toilet for 30 minutes, an hour. Don't do that. You're hurting yourself. In 5 minutes, be out. Whenever you have the urge next time, go right away. Do not delay, as I said. Whenever you have the urge, go immediately. When you're cleaning up yourself, avoid wipes. Use bidet, use bidet, use the water. That's essentially stimulating your rectoanal area, will help in bowel movement. Avoid wipes. So that's some general recommendations for constipation. For diarrhea, soluble fiber, as I discussed earlier, foods rich in soluble fiber, take those. Avoid chewing gums. A lot of chewing gums have these sugar-free alternatives, sorbitol, xylitol, and guess what is that? It's a laxative. Sorbitol is a laxative. We give that medication to constipated patients so that they can have bowel movement. So if you're chewing that chewing gum, oh, it's sugar-free, it's good for me so that I'm not eating sugar. But we learned that artificial sweeteners are bad for your gut. Plus, they're giving you diarrhea. Many patients come to me, oh, I don't have diabetes, but just so that I avoid my sugar, I started eating these sugar-free things. And they start having this diarrhea. So be mindful. Evaluate your medications again, be it supplements, be it herbal medications, be it over the counter, they can cause constipation. Avoid processed food. Gastroparesis, sensitive stomach. Again, low-fat, whole foods, plant-based diet. Fat will shut down your stomach motility. Stomach will stop moving down if you eat fatty stuff. If you overeat, it will again shut down also. So low-fat diet, whole foods diet, no overeating, and make sure in between 2 meals, you at least have 4 hours. So that whatever you ate before has now digested and moved down so that you can put new stuff in. But if you keep stuffing every 2 hours, we used to give this bad recommendation in the past. Oh, we have small meals frequently. Bad idea. That actually ruins your diabetes. So don't do that. Have 16/8 intermittent fasting. So you should not have more than Ideally, no more than 2 meals, but I give my patients discount. You can have 3 meals, but 1 meal will be just fruits. That probably is in between 2 meals. So 10 a.m. your first meal, 2 p.m. just fruits, 6 p.m. your second meal, done. No more. Don't need to eat constantly. Only eat when you're hungry. All right. You control your diabetes, your gastroparesis will get better. Of course, if it's chronic, you've had that for decades, then it becomes very difficult. Exercise is going to help a lot. Stomach cancer, I'm writing an article right now. It will come out in a journal called Current Opinions. I'm very mindful of time. I'm going to take a few more minutes. And same, animal products, any cancer really, animal products have H. pylori bacteria. That bacteria can stay in your stomach, and majority of 80% of stomach cancers are because of this bacteria. So if you avoid animal products, dairy products, you won't have this bacteria. No alcohol, no tobacco, no animal products at all. They're all carcinogenic. There's a lot of science behind it, how the nitrates in the meat, heme in the red meat, cholesterol in any kind of, even eggs have tons of cholesterol in there. By the way, no plant product will have cholesterol in it. Only animal products have cholesterol in it. Toxins, high fat, all of that is dangerous for causing stomach cancer. High salt diet, nowadays, everything has salt in it. It's a preservative. So we're eating like 6 to 7 grams of salt or 10 grams of salt in a day. Ideally, you should have less than 2 grams of salt in a day. If you eat, simple thing is look at the calories, number of calories that you're eating. And if your sodium content is less than the number of calories, you're good. It damages the safety layer over your stomach wall, allowing the carcinogenic, cancer-causing compounds to invade and cause problem. So what should you do? Whole grains. Whole grains have shown to be protective for stomach cancer. Fruits and veggies, low salt diet and low fat diet. So it comes back to what? Low fat, whole foods, plant-based diet. As simple as that. Fatty liver disease. Nowadays, that's become a big, big problem. Oh, like I don't drink, but you know, the sugar and the processed food that you eat is converted into alcohol by your gut bacteria, bad gut bacteria, and your liver starts seeing the result of it. So your liver looks like an alcoholic liver, even though you don't drink alcohol, and all because of bad diet. So besides the 6 things we talked about, do fasting, not just intermittent fasting, but do 24 hours fasting, 48 hours, 72 hours, water fast, dry fast. Do more fasting so that you burn away all that fat, and make sure you continue to exercise. Otherwise, you will lose muscle. You don't want to lose muscle. You want to lose fat. So even if you're fasting, make sure you exercise. All right. And not just cardio. If you just do cardio, you will end up losing muscle as well. So you should do strength training along with cardio. Cardio is good, but limited, not all the time. Zero cardio is bad. Too much cardio is bad. Limited, 2 to 3 days a week. Do resistance training, weightlifting, body weights, any kind of where you're building up your muscles. All right. So fasting has tons of benefits. If you want to make your kids smarter, teach them fasting. Your brain cells get boosted. And there's whole theory behind it. Johns Hopkins has done tons of research on that. So I think those are the things I want to talk about. Gallstones, the same rationale. There is a lot more to talk about, but I think I'm going to stop here. We are way over time, and the questions keep coming. I'll be happy to. For burping, is the same explanation. There is nothing different. Whatever I have explained in different diseases, you apply all of that in your life, and you'll see burping will start disappearing. How long should you wait after eating to drink water? I don't give that kind of restriction. Make sure you drink a few sips of water. Make sure you clean your mouth, you quench your thirst. But if you're drinking a couple of glasses, 3 glasses, 4 glasses, just because you should have enough water, then wait for an hour or 2 before you drink so much of water. But you can drink a few sips of water during eating and after you eat as well. Komal, I think I have addressed majority of the question. There's one question that was specifically asked to me. How do we know we have good bacteria? Will stool test indicate any, or there is any medical test? Don't do any of these tests. I always say that if you get a test result, how is it going to change your management? What are the things that you're going to change in yourself? if that result comes and it tells you like you're 20% of this and 30% of that, what are you going to do differently? You're going to do the exact same thing that we talked about just now. So don't waste your money on doing these kind of stupid tests. A lot of people sell it and don't fall for it. Okay. So I don't think you need to do any of those tests. Just make sure you follow all the recommendations that we've discussed and you're going to be in great shape.
Thank you. Thank you, Pritesh. That was so wonderful and, enlightening actually. So
My pleasure. My pleasure. Hope it helps.
thank you for all your time. I know you're moving and, there's so much you have to do. Thank you.
That's all right. It's my pleasure. Good luck to everybody. And if you have any questions, you can send me a message. I'll be happy to talk later on.
Sure. Thank you. So any questions for Dr. Mutha, you can either email those to me or anything, I can forward those. So, and we hope to see you back sometime again. This was our first time hosting Dr. Mutha, but I hope we'll see you again sometime.
It would be my pleasure, certainly.
Sure.
Okay.
Thank you.
Thank you.
All right. Good night, sir.
Good night.